Hi, I'm Dr. Diviya, your gynecologist. Today we are going to talk about vomiting in pregnancy. Yes, it is quite a common symptom. Almost 50% of the women suffer with vomiting and around 25% suffer with nausea. But not all vomiting is worrisome. Vomiting in pregnancy kind of varies, though it is called as morning sickness. It does not necessarily always have to be present in the morning. Some women tend to have more of nausea towards the end of the day too. So when do we consider it as abnormal? Is only when if someone is vomiting like for more than 6 to 8 times in a day and they are not able to do their regular activities, or there is a fall in the urine output, or if there is a fall in the BP. Only in such a situation we diagnose the condition as hyperemesis gravidorum and start initiating treatment for it. Just having vomiting once or twice a day is perfectly alright. More so, it is considered as a good sign because vomiting is a result of the HCG hormone, which is a pregnancy related hormone. This particular hormone kind of supports the pregnancy. So having good amount of HCG indicates that your pregnancy is well supported and there is very low chance of you ending up with an abortion or a miscarriage. So vomiting is a good sign. So when a woman is having vomiting, actually the doctor feels happy. True. So do not worry about having nausea or vomiting in pregnancy. It will definitely not hurt or harm you. But if you are having vomiting for more than 5 episodes in a day, do have a consultation, and we have good treatments available starting from oral tablets to injections. So we can see what suits you best and we can treat you accordingly. If there is a large amount of loss of minerals during your vomiting, it can lead to few complications. So you have to be cautious and you have to act in the right time. The common vomiting tablets which are given sometimes are not being used because of the fear of having a growing baby within. Of course, we do know that there is a baby within and you will be given the most safe drug possible. The commonly used drug which prevents vomiting is actually a form of a vitamin which has the capacity to control the vomiting. So depending upon your condition, we can time the tablet like twice a day or thrice a day. So if you happen to consume a tablet and if you have to vomit again, you need not have to repeat your tablet again. So what are the precautions or what are the tips you can follow to reduce this nausea and vomiting? I tell my patients basically not to stay empty stomach for a long duration of time. So if you go empty stomach say for more than 4 hours, there is a good increase in the acid in the stomach, which kind of leads to reflux and it will result in vomiting. So every 4 hours, make sure you are having some healthy snack. It can be fruits, it can be veggie salads, it can be sprouts, it could be any of these. But every 4 hours, make sure you have something to snack on. When you go to bed and you wake up, there is a fasting of almost 10 hours. So after this fasting, if the first drink happens to be completely liquid, there is a good chance the women may throw up immediately. So if you are having a tendency of vomiting, make sure the first bite that you take is something semi-solid. And maybe after a half an hour or so, you can have your regular morning drink. But make sure that the first drink is not a liquid drink. And you have to restrict your spice and oily intake which again can aggravate nausea and vomiting. And of course, there are few food substances specific for certain women which can aggravate nausea and vomiting. So, if you can identify any such substance, it is better to stay away from them. So, if there is vomiting for 1 or 2 times in a day, do not worry. Keep hydrating yourself. Keep having good amount of nutrition, and that will be taking care of you. And slowly, after around 12 weeks, between 12 to 14 weeks, these symptoms will reduce on its own. So do not stress about it. Do not think it will cause any kind of harm to you. So vomiting in pregnancy is very much normal. You need to have treatment only if you cross the limit of 5 episodes in a day. Thank you. Bye.